Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, salam sejahtera untuk kita semua. Kembali lagi bersama saya Herawati Anggraini selaku moderator pada acara webinar kali ini. Terima kasih untuk para dokter yang sudah berpartisipasi dan bergabung pada acara webinar ST kali ini yang bertemakan Achieving Effective Skin Rejuvenation Using JixiMTP36 Multi-Peptide and Clapio Cell PDRN Salmon DNA. Baik, sebelum kita mulai ke acara yang pertama, akan ada sambutan dari CEO kami, yaitu dari Mr. Moses Yang. Kepada beliau, saya persilahkan.
Hello, I'm Moses, a director of ST Indonesia. First, thank you very much, Dr. Choi, for your time and kindness. We are very honored to invite you as a speaker today. We hope your lecture will be helpful for all participants and they enjoy new information from you today. And thank you our precious participants. We are very happy to introduce a brilliant and handsome speaker, Dr. Choi, and quality products at Clapio and JixiMTP36. There are many similar products in the market, so it is somewhat difficult to distinguish each product's features. So it would be a great time to recognize benefits of Clapio and JixiMTP36 so that you can properly use them to your patients. We really hope it will be a valuable and informative time for you. Once again, thank you very much for your time. Please enjoy it. Thank you.
Baik, terima kasih untuk Mr. Moses Yang untuk sambutan hangat untuk para dokter yang sudah bergabung.
Halo, selamat siang dokter semua. Perkenalkan, nama saya Martin. Hello, my name is Martin. Today I will be your second moderator for this webinar with topic Achieving Effective Skin Rejuvenation using JixiMTP36 Multi-Peptide and Clapio Cell PDRN. Okay, before we start the session, let me introduce our speaker today, Dr. Hosung Choi. Dr. Hosung Choi was graduated from Yonsei Medical College, Seoul, Korea. He is Chief Board Member of Korea Aesthetic Surgery and Laser Society, Chief Board Member of Korean Academy of Facelift and Contouring, Global Key Doctor of GCS Bio Clapio Cell and JixiMTP36, Global Key Doctor of Samyang Holding Corporation Kroki, Global Key Doctor Ildong Health Tech, ID Fresh, and etc. Before we start the presentation, hello Dr. Choi, how are you today?
Hello. Hello.
Nice to
I'm
see you
Dr.
again.
Hosung Choi. Can you hear me clearly?
Yeah, it's clear.
Okay, perfect. First of all, I'm really happy to be part of this great seminar, and I really thank you for inviting me as a speaker.
Now we can start the presentation, Dr. Choi. The time is yours.
Okay. Hello, I'm Dr. Hosung Choi, a cosmetic surgeon from Korea. This time, I'm going to talk about achieving effective skin rejuvenation using multi-peptide and PDRN, which are JixiMTP36 and Clapio Cell, made from GCS Bio company. If you look at recent global aesthetic trends, you will often see the following words. People are seeking more natural outcomes, and they don't want to lose their own genuineness after cosmetic procedures. Patients visiting aesthetic clinics are getting younger to get rejuvenation procedures, such as botulinum toxin or skin boosters that have become more important in the aesthetic medicine. According to a recent published paper, excessive cosmetic interventions may make people lose not only their genuineness, but also their beauty. And attractiveness is a volumetric area defined within 3D plane in which the dimensions of beauty, genuineness, and self-esteem are the indicators. One of the medical aesthetic trends is that patients seeking aesthetic treatments are getting younger. they want to maintain their looks and youthful appearance before losing them. Like her, keeping her appearance unchanged after nearly 30 years. Incredible. It's a good example of rejuvenation. Therefore, we should pay attention to anti-aging procedures that make more natural and subtle changes through a paradigm shift. The new trend of the aesthetic market is that the mainstream is moving from facial contouring to skin rejuvenation. Following this trend, the skin booster market is also rapidly growing lately, resulting in a market shift from filler to skin booster products. Basically, in order to keep our skin young and healthy, we need to protect, nourish, and remodel our skin constantly by using these elements, which are, in general, key elements for skin boosters. The clinical efficacy of skin boosters includes the improvement of skin texture, radiance, smoothness, and firmness. In other words, they can make your skin healthy by strengthening the skin barrier. Clinically, there are two main ways to rejuvenate the skin. One is hot rejuvenation, and the other is cold rejuvenation. Hot rejuvenation is a method by heating the target tissue, such as various lasers and energy-based devices. And cold rejuvenation is a method using hydration and biostimulation without heating the tissue. Recently, skin boosters have become a representative treatment modality in cold rejuvenation. However, in practice, it is always true to combine hot and cold rejuvenation method to maximize the result. Currently, there are so many different kinds of skin booster products on the global market. Among them, at this time, I'm going to focus on two products from GCS Bio company, JixiMTP36 and Clapio cell. Let's have a look at MTP36 first. MTP36 provides moisturizing, lifting, brightening effects for the skin. It also provides dermal tissue regeneration. Like many other skin booster products, MTP36 is made of multiple components such as HA, minerals, vitamins, amino acids, and so on. However, one distinct difference from other skin booster products is that MTP36 can give additional skin lifting or tightening effects, similar to botulinum toxin effects. About this, I will talk about a little while later. Each of these various components plays a role in enhancing thermal environment through improving the function of fibroblasts. And as a result, the function of fibroblasts will be improved and the number of fibroblasts will be increased in our skin. Among them, copper tripeptide 1 promotes collagen production and skin regeneration, which give effective improvement of hair loss, skin wrinkles, and also stretch marks. Acetyl hexapeptide 8, or arginine, is a peptide of 6 amino acids mimicking the N-terminal of SNAP25, which acts on neurons similar to the action mechanism of botulinum toxin, and competitively binds to the snare complex protein. And finally, it inhibits the formation of snare complex and inhibits the secretion of acetylcholine temporarily, resulting in muscle relaxation. So it is also called Botox peptide. MTP36 contains these several other peptides that play different roles in rejuvenating the skin. 10 vials are packaged in one box, and each vial consists of 3 ml of solution. Second product is Clapio cell, made of PDRN. As we all know, PDRN is made from small pieces of DNA extracted from sprouts, sperm, which have 97% similarity to human DNA. PDRN has a selective affinity to A2 receptor, resulting in a powerful regenerative effect that promotes wound healing process and tissue regeneration. In addition, PDRN is directly used as a material for DNA synthesis through a salvage pathway. Clapio cell consists of PDRN and HA. The titer of PDRN is quite high, about 100,000 ppm per 5 ml, which is about 3 times higher than other common PDRN cosmetics. Thanks to this highly concentrated PDRN, Clapio cell can provide long-lasting, remarkable skin regeneration effect. It also shows a powerful neocollagenesis, so a superior effect of wrinkle improvements can be achieved. The clinical efficacy of Clapio cell includes skin brightening, skin pores, and texture improvement. And also skin laxity can be improved as well. Since PDRN has an anti-inflammatory effect, it may be applied to improve chronic inflammatory skin disease, such as atopic dermatitis or acne redness, especially the acne from adults patients. Now, let's talk about the clinical use of these two products. Both products have similar clinical indications and treatment methods. The main effect of JixiMTP36 is skin revitalization, while the main effect of Clapio cell is skin regeneration. Therefore, in my opinion, I recommend to use MTP36 in relatively younger patients in order to preserve and strengthen their skin condition. And Clapio cell is in relatively older patients to regenerate and remodel their aged skin. However, since their common effect is biostimulation, so they can also make collagen in our skin. The criteria for selecting each product may vary depending on the patient's condition or treatment results or the physician's decision. According to some past studies, a quantitative and functional decrease in fibroblasts due to aging is found to be more pronounced in papillary dermis than in reticular dermis. That is, the target layer should be the upper part of the dermis, which is papillary dermis. So most skin boosters should be delivered to the papillary dermis, which is located approximately 300 micrometers or 0.3 millimeters from the skin surface. There are many options for intradermal delivery of MTP36 or Clapio cell. The most common used drug delivery methods are mesoroller and auto-NTS in general. And for painless treatments, you can use ultrasound device or iontophoresis. And to improve skin pores or skin laxity, then I would recommend CO2 laser or needle RF devices. Personally, I prefer to use a meso roller or multi-needle injector. You can also inject manually using 33 gauge needle with 4 mm length, but you should inject very tiny amount per point, and you should inject very evenly without making any bruising. When treating the face using a meso roller, it is recommended to choose 0.5 millimeter length of needles. And basically, I roll for 10 minutes when treating the whole face, carefully rolling in 3 directions to make sure that the skin holes are evenly distributed. For easy, fast, and safe injections, it is most ideal to use a multi-needle injector. Especially, I think I mostly use this multi-needle injector personally. When using it, you can easily deliver the solution intradermally without bruising. And mostly 32 gauge multi-needle is commonly used with the injection depths between 0.7 and 0.8 mm. For the initial treatment, it is advisable to repeat at least 5 sessions of treatment at 2 weeks of intervals for the first 3 sessions and 1 month intervals for the last 2 sessions. So it will take 3 months to complete 5 sessions. Although the outcome may not be that great after only one single treatment session. However, a more obvious result and a better longevity can be expected after all 5 treatments are completed. And to maintain a progressive effect, it is better to repeat an additional treatment session every 2 to 3 months. Actually, I let my patients to choose the intervals. The amount of use should depend on the area of treatment. Of course, more solutions are needed to treat a wider area. Usually, at least 3 ml is required for full face treatment, including the forehead, and 5 ml for full face and the neck. Now I'll show you some video. Sorry, I will. Okay, the left video is using meso roller. As you see, during the treatment, I adjust the pressure of the roller depending on the area on the face in order to control the depths of the needle onto the skin. For example, around the eyes in the periorbital area, I do not press too much because the skin is quite thin. However, when treating the cheek, I press the roller to deliver a little deeper in the dermis. And as I already mentioned, I spent about 10 minutes to roll the full face. As you see, when I treat infraorbital area, I pay more attention and I do more carefully. And the right video is using a multi-needle injector. It's quite easy and quite simple. Actually, I deliver about 0.003 ml per shot. And so when I use 3.0 ml of solution, then I need about 100 shots. So I think 100 shots can be covered for the full face. However, if the surface of the face is quite large, then probably we will need more solutions. When you inject into 0.7 to 0.8 mm of the skin depth, then there will be no bruising, maybe very tiny bleeding, but it's not a big deal. And it's almost no pain. It's not painful. So patient is quite, they usually feel very comfortable during the procedure. Okay, and this is another video about Clapio cell application using various methods. I will show you various methods. First one is auto MTS. It's also very useful and convenient because it's very fast, and it can also be applied onto the very curved surface, like above the nose, because on the nose, it's quite difficult to effectively deliver the solution by using meso roller. So sometimes I use the auto MTS when treating a very curved surface. But I think it's a little more painful than using meso roller. So the needle depth should be about 0.5 to 0.6 mm. And this one is CO2 fractional laser, but it's used as extreme mode, that is very soft and smooth delivery of CO2. So the downtime is only 1 or 2 days, because I'm not focusing on skin ablation, but I'm focusing on the delivery of the solution. So the depth is almost 0.3 to 0.5 mm. That's why the downtime is quite short, and it's not that painful during the procedure. And after CO2 laser, we can just apply the solution, the Clapio cell, and just tapping like this, finger tapping is quite useful to enhance the delivery. CO2 laser is used mostly for correction of skin pores or skin wrinkles or skin scars. If patients have very thin skin, this kind of laser is not appropriate. So then I will use only for injector or meso roller or ultrasound. And finally, the third one is ultrasound. Yes, I use ultrasound named LDM. It's also used alone to rejuvenate the skin, but if we combine with Clapio cell, it's very effective. Mostly for those who have very sensitive skin. Okay, MTP36 and Clapio cell can be combined with many other treatment modalities to create a synergistic effect depending on the purpose of the treatment. For skin brightening, I recommend Q-switch NDIAC laser or IPL laser before applying the solutions. For skin texture improvement or pore size reduction, I recommend fractional laser or needle RF before applying them. And for skin tightening, combining RF or long pulse laser is quite helpful to achieve better results. Personally, I prefer to combine Q-switch and YAG laser with JixiMTP36 for skin brightening, RF or CO2 fractional laser or long pulse genesis laser with Clapio cell for skin pores and fine line correction. They can also be applied to the body, especially on the scalp, to improve hair loss by strengthening hair follicles, or other areas such as neck, décolletage, abdomen, and arms as well. After 3 treatment session using MTP36, her overall skin tone became brightened with improvement of pigmentation. Not only that, her nasolabial folds have improved as well. She's in her mid-30s. Her skin is very sensitive, so that she has experienced many side effects after laser treatment in the past. So I decided to apply Clapio cell 5 times using LDM ultrasound. And after treatment, her face became brighter and healthier. This case shows a marked improvement of the skin turgor and texture after 5 treatment sessions of MTP36. If you see her forehead, you can obviously see the result. After 8 sessions, we can see the improvement of the skin tightening more obviously. And she got RF combined with Clapio cell. MTP36 is also quite effective to male skin when treating skin pores or skin scars. After many times of treatment sessions, not only the skin pores, but also his forehead lines are improved. Okay, before wrapping up my presentation, let me briefly talk about cumulative effects of skin booster treatments. Suppose you are driving on the road of aging, and suppose you chose the road of skin booster treatment instead of the road of no treatment. The speed will be gradually begin to decrease shortly after starting skin booster treatment, such as MTP36 or Clapio cell. However, after a long period of time, the result for the 2 roads will gradually differ greatly. That is, the distance between the 2 will gradually increase over the time. Therefore, it is desirable to start skin booster treatment from as early as possible for better preservation. That is how I explain to my patients before starting the treatments, because patients should be aware of the process of skin booster treatments, because some patients are expect very highly, and they expect usually results with filler injection or surgical interventions. But skin boosters are not a surgical intervention or a filler injections. We need many sessions and cumulative sessions of treatment to see the results. So that's why it takes time, and patients should start as early as young as possible. Here's my conclusion. MTP36 and Clapio cell do not only recover skin damages, but also they improve skin quality by enhancing epidermal and dermal environments. Through these multiple actions, a true anti-aging result action can be achieved. Okay, that's it for my presentation today. Thank you for watching my presentation. So I will stop quit my sharing.
Okay, thank you, Dr. Choi, for your presentation. This is very interesting presentation. Now we are moving to the Q&A session. The first question is from Dr. Robertus Bryan. He's asking for, is it JixiMTP36 is safe for acne patient? And which one is more effective to use JixiMTP36, inject manually with needle or with device? Which one is more effective?
For acne patients.
Yeah.
Mm-hmm. Okay. I think acne needs some anti-inflammatory actions. So I would recommend to use Clapio cell, but sometimes it's not always true. I mean, MTP36 can also be used, but in general, I would recommend to use Clapio cell. And it depends on the patient. I mean, how to inject, manually or using multi-needle injector. It depends on patient's skin condition. That is, if a patient has very severe inflammations and with acne, then I would recommend to use a manual injection, because we should be very careful where we should distinguish the area where we should not inject and we should inject. For example, on the acne, which has very deep inflammation, then it's not good to inject directly. Rather, I would inject just around the inflammation. However, we cannot control when using multi-needle injector. But if a patient has a chronic mild inflammations, then I think multi-needle injector will be more convenient. So we should choose the method depending on the patient's condition.
Okay, thank you. Let me briefly explain in Indonesian. Jadi untuk Dr. Roberto, untuk pasien yang acne itu, sebenarnya karena di Jixi ini ada anti-inflammatory, jadi tidak masalah untuk menggunakan JixiMTP36 untuk pasien yang acne. Tapi kalau misalnya ada untuk treatment mana yang efektif antara injeksi pakai jarum biasa atau multi needle, itu lebih efektif kalau misalnya kalau untuk yang berjarak baiknya kita pakai needle aja, karena kita bisa mengontrol area mana yang perlu diinjeksi. Karena kalau misalnya pakai multi needle itu kita nggak bisa mengontrol. Misalnya kalau ada pasien yang dengan ada jerawatnya yang sedang aktif, itu baiknya dihindari gitu. Okay, so we move to the second question. This one from Dr. Evi Deviani. Dr. Choi, do we need allergy test before we doing JixiMTP or Clapio cell?
You mean skin test?
Yes.
I don't think so, because all the components of two products are very safe. But for some patients whose skin are very extremely sensitive, then after injection, either manually or by a multi-needle injector, some patients may have an allergic reaction after treatment. Then it's necessary to change the method by without injection. I mean, ultrasound or energy-based device first and applying the solution. Because for these patients, even though the components are very safe, their skin can react, can show some allergic reaction by their skin problems. So for those who have some experience of allergic reaction after injection, then it's better to change the method. But mostly, we don't need to do skin test because these products are very safe and downtime is very short.
Jadi begini dokter, untuk semua pasien, jadi kita tidak memerlukan skin test dulu karena memang untuk dari JixiMTP36 dan Clapio ini bahannya juga aman gitu. Jadi dan jika memang ada pasien yang mempunyai kulit yang sensitif, kita menyarankan untuk melakukan treatmentnya jangan diinjeksi, melainkan melakukan topikal, yaitu misalnya bisa pakai RF atau ultrasound. Gitu. And then we'll move for the third question. This one from Dr. Lia and Dr. Aulia Shanas. Can we do JixiMTP36 with dermapen? And then can we mix JixiMTP36 or Clapio with Botox?
Yes, dermapen. The dermapen is very similar to auto MTS, I think. So you can use, of course, the dermapen to deliver MTP36 or Clapio. And yes, I don't personally. I don't like to mix too much with other solutions, but botulinum toxin is quite useful, and I often mix with MTP36 or Clapio, especially for patients who have skin pores and very greasy skin with oily skin. Then I mix botulinum toxin because botulinum toxin has an effect of they can decrease the sebum secretion, and also for acne patients, botulinum toxin could be effective. And yes, for skin pores or acne skin or greasy skin, and then I mostly mix botulinum toxin with MTP36 or Clapio. And usually I mix 20 to 30 units per session, but mostly 20 sessions, because if I mix too much botulinum toxin, then the patients may experience of muscle weakness, so they cannot express their muscle, so they may be feel some discomfort after procedure. So, however, 20 units is very safe.
Okay, thank you. Jadi dokter, untuk JixiMTP sendiri bisa dicampurkan dengan Botox yang mana itu sangat berfungsi bagus untuk pasien yang mempunyai open pore yang besar, misalnya pori-pori yang besar, lalu juga bisa pasien yang dengan kulit berminyak gitu. Tapi memang kita tidak bisa mencampurkan Botox itu terlalu banyak, yang mana maksimal itu di sekitar 20 unit. Kenapa? Karena memang kalau kita mencampurkan botoxnya terlalu banyak, itu akan membuat pasiennya itu sedikit merasa paralyzed gitu. Jadi ototnya itu agak terganggu. Jadi lebih baik maksimal itu dicampurkannya 20 unit.
I saw the last question on the chat box.
Yeah.
Yes. Can I answer before wrapping up my session?
Okay.
Okay. She wrote in English, so I can explain.
Okay.
She said, while combining MTP36 with Botox, 22 units is mixed together, and can it be done using microneedling? Yes, but for better results, I would recommend to use multi-needle injection or manual injection, because botulinum toxin is quite expensive. So if you want to see the result from botulinum toxin, then it's better to be injected rather than just applying. Because when you apply the solution, then only some of them will be delivered into the dermis. So when you use botulinum toxin, then it's better to use injection, either by manual injection or multi-needle injection.
Okay, so if we mix the Botox with Jixi, and then for the layer injection, which layer we need to inject?
Yeah, it's the same. Upper dermis, so 0.7 to 0.8. But when you inject manually, then you should inject a little deeper because, I mean, if you inject into the 1 mm length, depth, then the solution will be a little regurgitated when doing manually, when doing injection manually. So anyway, so it's quite shallow, not deep. So you should not make severe bleeding. If you see some bleeding, that means you injected too deeper. So you should make a wheal on the skin. So that means upper to mid dermis. That's the appropriate layer.
Okay, Dr. Choi. Thank you for your answer. Mm-hmm. Okay, this one the last session for our Q&A. We'll move to Miss Hera.
Terima kasih Mas Martin dan juga thank you for Dr. Hosung Choi untuk presentasinya. Semoga apa yang dipresentasikan bermanfaat bagi kita semua. Dan untuk question yang belum dijawab oleh Dr. Hosung Choi, dokter bisa langsung mention atau DM ke Instagram kami yaitu @st_as. Nanti akan dibantu jawabannya oleh Dr. Hosung Choi-nya langsung ya dok. Dan saya akan menginformasikan kembali untuk pemenang giveaway yang sudah dilakukan dari minggu lalu dok. Caranya dengan dokter memposting newsletter yang ada foto Dr. Hosung Choi-nya, diupload di Instagram dokter, dan likes terbanyak akan menjadi pemenangnya. Dan saya akan memilih 2 orang pemenang dengan total likes yang terbanyak. Pemenangnya akan mendapatkan 1 box Clapio Cell DNA Salmon dan juga 1 box JixiMTP36. Dan untuk pemenang yang pertama yang berhak mendapatkan 1 box Clapio Cell ada dengan username lanesda_looks dengan total likes sebanyak 528 likes. Wah, selamat ya dokter mendapatkan 1 box Clapio Cell DNA Salmon. Dan juga untuk pemenang yang kedua yang berhak mendapatkan 1 box JixiMTP36 yaitu ada username bernama Asyahnas04 dengan total likes terbanyak yaitu 868 likes. Wah, selamat ya dokter mendapatkan 1 box JixiMTP36. Dan untuk info selanjutnya untuk pengiriman bisa langsung menghubungi sales area manager masing-masing ya dok. Dan untuk dokter-dokter yang belum beruntung mendapatkan hadiah giveaway dari kami, jangan berkecil hati karena kita juga memiliki promo untuk pembelian Clapio Cell DNA Salmon 1 box saja atau 1 box JixiMTP36, dokter bisa mendapatkan 1 box Clapio Glutathione secara gratis. Promo ini berlangsung dari tanggal 16 Januari sampai dengan 17 Januari. Jadi promonya sudah berlangsung dari hari ini sampai dengan besok ya dok. Dokter bisa langsung chat ke sales area manager masing-masing mulai hari ini. Dan untuk syarat dan ketentuannya bisa diinformasikan oleh sales area manager masing-masing. Dan terima kasih untuk para dokter yang sudah berpartisipasi dan sudah bergabung dari awal acara hingga akhir acara. Kurang lebihnya saya mohon maaf, nantikan webinar kami selanjutnya. Bila ada kesalahan, terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Selamat siang.